Hello, everyone. Greetings, everybody. I'm Priyanjali from Radiance with You team. I'm sure all of you must be keeping good health. Welcome, everyone, to our special YouTube live session. In this live, we will be sharing light on a condition that affects millions worldwide. Acne isn't merely a surface issue, it can deeply impact one's emotional well being. Beyond the physical blemishes, it can erode self confidence, leading to anxiety, depression, and social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why in today's live, we are aiming to dispel myths, promote understanding, and empower individuals to seek effective treatment. Today, we are diving into the topic acne management with our skin expert. Whether you are struggling with breakouts yourself or simply curious about maintaining clear, healthy skin, this session promises to be both informative and engaging. Today, we are honored to introduce Dr. Shehla Agarwal, a renowned skin expert from Delhi. Dr. Shehla Agarwal is the director and consultant dermatologist at MEHAK-The Derma and Surgery Clinic at South Delhi. An alumnus of Maulana Azad Medical College, Delhi, she is in practice for more than 25 years. Dr. Shehla conducts workshops for public education on skincare for schools and colleges and public forums on skin and hair related problems all over the country and abroad. In association with Government of India, she developed an employment program to train girls for weak economic background to increase their employability. In recognition of her gainful efforts for upliftment of underprivileged girls in her field of expertise, the association Ek Ki Rasta have honored with her Citizen Gratitude to Gallant Warrior Award. Today, we are privileged to have her with us, and she will be sharing her insights on acne and its management. We extend our heartfelt gratitude to you, Doctor, for joining us. Without further ado, over to you with the first topic and the first question, which is what is acne and what are the types of acne lesions?
Thank you so much for inviting me and having me over here in every live. I have to tell you that the audio is not very clear to me. So if the audio is not very clear from your side, so that I can hear it, and I hope my audio is better.
Doctor, I believe
Acne
the
is something
audio is
which
clear to the audience.
is part of growing up. Activated and they start producing an oil. Acne कहीं ना हर किसी को किसी ना किसी लेवल का होता है. Acne, we of acne are you going to get? Another factor which is important is that what is your lifestyle? The lifestyle becomes more important beyond 20 years of age, or you start getting acne later in life. So then we start looking for other reasons rather than physiological reasons. So acne is very much a part of all of us. So we don't have to be worried about it, but we have to learn how to manage it.
Right, right, right. Now, because now that we know that acne is a condition and it's not a disease like people treat it, let us know, does specific area, acne in specific area have different causes behind it?
Acne is a lesions of sebaceous gland. The distribution of this is the question and I'm answering it over here. So I'm answering if the acne is related to a specific area. Yeah. The acne is related to the area where our sebaceous glands are distributed on face, V of neck, upper arm, and upper back, and in the scalp. So people normally who have acne prone skin will have acne on these areas, and they have more of oily dandruff and sometimes folliculitis in the scalp also. So those are the areas which are definitely affected, and then कोई भी दाना होता है या कोई भी रैश होती है तो उसको एक्ने मान लिया जाता है. बट अगर किसी और बॉडी पार्ट पे Let me continue with acne. How do the patients come to us? Normally, they are the teenagers who come to us, and teenagers get very hypersensitive about acne. My first and the basic job is to counsel them, because counseling is something which they have to understand that acne will be there till they are around
Mm,
21 years of age. We have to learn and we have to teach them how to control acne. Acne cannot be eradicated. There is no way that I can say now you will not get acne. It is, I can teach you that what you can do so that the acne doesn't trouble you, and most important part, that the acne should not leave marks. एक्ने को ठीक करना बहुत आसान है, लेकिन एक्ने के मार्क्स और स्कार्स को ठीक करना बहुत ज्यादा मुश्किल है. दूसरी चीज ये है कि एक्ने जो प्रिपॉन्सिटी है, कि उसकी जो ग्रेविटी है वो चेंज होती है अकॉर्डिंग टू द सीजन. सो इन समर्स, बिकॉज वी आर स्वेटिंग अ लॉट, the sweat and the sebum which is produced by the sebaceous gland forms a layer on the skin, and the chances of you getting acne is much more as compared in winters, because the skin is slightly dry, so there the acne oil also is less. Humidity again increases the production of the acne sebaceous gland sebum secretions. So acne, you have to learn that it has to be changed seasonally. It changes seasonally, so you have to change the skin care also season wise.
mm,
So what we teach you to do in summers will not be valid in winters, because if you use the same salicylic acid, same toners in winters, your skin will get extremely dry. And acne
mm,
prone skin, if it gets dry, then the body sends signals to the brain to produce more oil, and that leads
mm,
to more production of acne oil also. So it becomes a fallacy. गर्मी में तो acne बढ़ ही रहे हैं, लेकिन
right.
सर्दी में अगर आप अपनी स्किन को अच्छी तरह से मॉइस्चराइज नहीं कर रहे हैं तो वो रिबाउंड एक्ने बढ़ने लगते हैं. तो ये बातें सब कुछ बहुत ज्यादा जरूरी हो जाती हैं. What you have to do to prevent acne and to take control of them is a routine. And the routine should
Mhm,
include, the most important part in acne treatment is cleansing. जो ऑयल निकल रहा है उसको आप एक हद तक ही कम कर सकते हैं, आप उसको खत्म नहीं कर सकते, खत्म करना भी नहीं चाहिए और खत्म करना भी नहीं चाहते. तो आपको जो ऑयल निकल रहा है उसको रेगुलरली क्लीन करना है, और क्लीन करने के लिए आप एक अच्छा पेस्ट इस्तेमाल करेंगे. इफ इट इज समर टाइम और अगर गर्मी ज्यादा हो रही है तो आप जो है यहाँ पर एक टोनर का इस्तेमाल करेंगे. टोनर कि आपकी स्किन को जो ड्राई हो गई है बिकॉज ऑफ स्वेट एंड बिकॉज ऑफ द फेस वॉशेस, उसके पीएच को नॉर्मल कर देगा. उसके बाद एक बेस्ड मॉइस्चराइजर यूज करना है. गर्मी में भी हमें मॉइस्चराइजर इस्तेमाल करना है. You have to understand that there are two kinds of oils in the skin. One is the skin cell oil, something which defines us, like, we have oily skin, dry skin, or combination skin. Another is the acne gland oil. So if your normal skin is dry, then there is chances that because of a rebound, the acne will be produced more. So you have to use a moisturizer, whether it is summers or winters. In summers, you have to use a oil-free moisturizer. It can be a gel-based moisturizer or it can be an oil control moisturizer. But to fix, you have to use the moisturizer. The acne creams, what we give, which is a whole plethora of creams, the most important being the clindamycin, the Azad, the tretinoin, they have to be used at night. The idea of using the repair creams at night is that our skin gets the sooner side at night of blood flow. So creams are more effective in at night. So that's why for repair and for if there are marks, we want to symptoms, that also we give at night. The whole idea is acne keeps on happening, but you have to wait for the acne to work so that it gets controlled. And once it's controlled, then you have to learn how to work on it so that it does not happen. But
right.
even if it happens, then you have to, even if it happens, then you don't have to be bothered about it. It's part of the whole game. So just get into it. But the issue is that if you're not able to control the acne with the help of the over the counter creams, then you have to. I'm sorry, I'm looking at the phone because I cannot see my anchor over here, and I'm doing all the
Okay, okay.
question and answer on myself.
Doctor,
So
doctor, I can hear
I'm
you.
just
I can
writing.
see you
Where is the
thoroughly.
anchor? Is
So that is not the issue at all. We can hear you, doctor, and I think we are targeting the main point
because
today. Our viewers
questions
will be
one after
extremely
another.
happy to have you here online because uh, today
Okay,
आज
now
हम
I
ऐसे
now
ऐसे
I feel
बेसिक
more
बातों के बारे
connected.
में बात करेंगे, ऐसे बेसिक चीजों के बारे में बात करेंगे जो हम नॉर्मली मिस कर देते हैं नॉर्मल लाइफ में. वी मिस आउट ऑन द बेसिक्स और हम सिर्फ मेजर चीजों पे फोकस करते हैं कि हमारा स्किन एक दिन में कैसे इवॉल्व हो जाएगा, हम एक दिन में कैसे फेयर दिखने लगेंगे, कोरियन ग्लास स्किन के बारे में. विल टॉक अबाउट एवरीथिंग बट ग्रेट गोइंग डॉक्टर, वुड यू लाइक टू कंटिन्यू विद द सेम और शुड वी डाइव इनटू द नेक्स्ट क्वेश्चन?
Yeah. So I was talking about what you have to do about acne. First of all, that a routine person, a normal person, a teenager have to cleanse, moisturize, and then apply the anti-acne creams at night. If you have marks,
Right.
then the doctor will work on the marks. Look, what you have to understand is that if acne, there are always different stages of acne control. First of all, is that you do it on yourself. Try to do it on yourself. Try to do it with a toothpaste and things like that. Then you go to your local chemist and get a cream. Then you go to your local GP, the general physician doctor, and they try and give you the creams. 80%, 90% people are controlled with these. There is nothing wrong in it. Toothpaste is wrong because toothpaste, it's just drying the whole area, and it leaves a very
Mm.
bad mark. Then it becomes very difficult for us to treat the mark. So
Right.
if by 2 to 3 weeks or in summers you feel there is an exaggeration of acne, definitely visit the dermatologist because every branch has its way of treating, and acne comes in dermatologist purview. So we'll teach you and we will guide you how to keep control of acne in different weathers. Again, most important thing is what works in June and July in India will not work in January and February. So you have to renew the treatment within different seasons. You will understand what we are trying to do, and our job is actually to teach you how to take control of it. You don't
Right.
need to visit the doctor for your whole life, but
Mm-hmm.
you have to understand what the doctor is trying to do and trying to tell
Right.
you.
Right. Right. I think, doctor, we started with a great point here when we are talking about this question, this particular question, that making them understand consulting the teenagers becomes very important because it's all to mind game and how people are influencing, people around us are influencing us, how social media is influencing us. Teenagers, specifically, as you mentioned, they are so much influenced nowadays. आजकल teenagers को देख के लगते ही नहीं है that they are teenagers. Everybody wants to look young. Everybody wants to look old. I mean, that's not a problem at all. But doctor, speaking about skincare that we were talking about, uh, is it really important for the teenagers to use such plethora of skincare, which you have mentioned earlier, that it's not important? If it's not, what is the basic skincare one can maintain for a teenager?
The teenage, especially till you are 20, is the problematic time because of oil glands being active. So
Right.
your aim should be to control the infection and inflammation. When you cross
Hmm.
your 20s, once the acne has become normal, then the youth is the biggest. It's a fountain of youth. Fountain of youth is something which makes you glow. So if you don't need too many things at that stage of your life, you don't need to apply a niacinamide in the morning, hyaluronic in the afternoon, vitamin C at night. 35 plus, yes, because we are working, the age is more there, it's a different ball game. But
Mm-hmm.
for you,
Hmm.
if there is any marks, definitely you can use. Look, Panjali, the problem is that we are living in different times. I've been in
Right.
practice for 25 years. I've seen all the times now. This is a different age. Different age means the attention span is very less. So whatever is being advertised, the first instinct is to buy it,
Mm-hmm.
not to research it, but to buy it. Once you buy it, your drawer is full of lots of things. Then you decide whether you want to do it, use it or not. And you have to be very clear that anything which you are using, it requires at least 20 to 30 days to give you the desired result which you desire out of it. So you
Right.
cannot be just buying things, throwing in your drawer, and then saying, oh, it's irritating me, and then moving to the next product, and then moving to the next product. So what you are doing, you are experimenting on your skin. And when you are
Mm.
experimenting on your skin, there will be a time in all our lives you'll reach, when you are 18, it's very difficult to think that someday you will be 35 and 40 also, but everybody will be. So then
Yes.
that time when you require something to work, it will not work, because you
Mm-hmm.
have already experimented with it and you have made your skin sensitive. My actual request with the younger people is, please don't try too many things. Your skin just needs cleansing, moisturizing, and if there are any marks, it needs a basic serum to remove those marks. You don't need a hyaluronic acid. Your skin is not dry. You don't need anti-aging. You don't need too many masks. The younger people don't need too many things. Problem is that the person is so parishan, they're hassled. There is no other way but to be saying that they're hassled, and they're hustling the parents also. So
Right.
parents don't know what to do. The person is hassled. They're trying to pick up different ideas and different things which are available. My request, visit a dermatologist. और आजकल तो
Right.
दिक्कत क्या हो गई कि dermatologist की भी लिस्ट 17-18 प्रोडक्ट्स की होती है. वो भी
Mm.
जमाना आ गया.
Right. Right.
तो वो भी
Now.
एक है कि जब आप डर्मेटोलॉजिस्ट के पास जाओगे, वो आपको 25,000 चीजें पकड़ा देगा. पर कम से कम
Mm.
आई कैन नॉट, नीदर कैन आई डू नॉर कैन आई राइट. इतनी प्रोडक्ट्स ना मैं लगा सकती हूँ, ना मैं दे सकती हूँ. पर जिसके पास जा रहे हैं, कम से कम वो आपकी स्किन के हिसाब से तो आपको देगा. आप एक्सपेरिमेंट तो नहीं करेंगे. डर्मेटोलॉजिस्ट के पास जाने
Right.
का फायदा यही है कि वो आपको असेस करेगा. एंड दूसरा, देयर हैज टू बी अ पॉइंट ऑफ कॉन्टैक्ट. इफ समथिंग इज नॉट वर्किंग ऑन यू, there should be somebody who can you go to and say कि this is not suiting me, so the person
Right.
knows and tells you क्या करना है.
Mm. Mm.
सबसे बड़ी
Mm.
चीज जो जरूरी है वो है काउंसलिंग. और काउंसलिंग पेरेंट्स की भी होनी है और काउंसलिंग बच्चों की भी होनी है. तो परेशान मत
Right.
होइए, वक्त है, गुजर जाएगा. सिर्फ कोशिश ये करें कि यहाँ पर निशान ना पड़े, क्योंकि अगर आप उसको स्क्रैच कर रहे हैं, अगर आप एक्स्ट्रा चीजें लगा रहे हैं, इट विल लीव अ मार्क एंड टू ट्रीट दैट मार्क. बिलीव मी, जॉन अब्राहम एंड अभिषेक बच्चन, अगर उनके वो भी एक्ने स्कार्स अगर लेके घूम रहे हैं, तो मुश्किल ही होता होगा ना एक्ने स्कार को दूर करना.
Right.
तो
Right.
एक्ने को ट्रीट करना, एक्ने के पीछे भागना ज्यादा जरूरी है, रादर देन लीव इट ओवर देयर एंड देन द एक्ने स्कार्स कम एंड देन यू आर लेफ्ट विद देम फॉर योर होल लाइफ.
Yes. I also think इसमें पेरेंट्स का भी रोल इम्पोर्टेंट है डॉक्टर. बिकॉज जस्ट येस्टरडे मेरी बात हो रही थी. देयर वाज अ यंग गर्ल, शी इज प्रोबेबली 16. मुझे पूछती है कि दी आप क्या लगाती हो अपने स्किन पे, प्लीज शेयर योर स्किन केयर रूटीन. नाउ द प्रॉब्लम इज, उनको ये नहीं समझ में आ रहा है कि मेरा स्किन उनका स्किन बहुत डिफरेंट है. माई एज इज डिफरेंट. मैं ऑब्वियसली बहुत बड़ी हूँ उनसे. प्लस जीन्स का भी एक बहुत इंपॉर्टेंट रोल होता है यहाँ पे. फ्यू पीपल आर बॉर्न विथ पर्टिकुलर टाइप ऑफ स्किन. आप जितना भी स्किन केयर कर लो, आप जितना भी इंजेक्ट चीजें कर लो, ये पॉसिबल नहीं है कि आपको अपने डिजायर्ड स्किन मिल ही जाए. हम इन्फ्लुएंसर्स को देख रहे हैं कि इसने ये मास्क लगाया, वाह इतना अच्छा काम कर गया, ओवरनाइट रिजल्ट्स हमें देखने को मिल रहे हैं. बट यू डोंट इवन नो उसका स्किन वैसा ही होगा. शायद वो एक पर्टिकुलर टाइप का ग्लो लेके आ रहा है. मे बी मेकअप, व्हाट्स बिहाइंड द कैमरा, वी डू नॉट नो. तो प्लीज
आई
आप ये
ऑलवेज
सब
से
वीडियोस.
रूपाली कि अगर ऐश्वर्या राय का भी मुंह धुलाओगे, तो एक आध निशान तो वहां भी नजर आ जाएगा.
बिल्कुल
जब आप
बिल्कुल.
स्क्रीन पे देख रहे हो, उसमें इतने फिल्टर्स हैं. Somebody was doing an online
हम्म.
consult with me, and there were so many filters on there. She says, I don't know how to remove the filters because that is how my screen is. So
राइट.
you
राइट.
yourself have forgotten what you are like. And one thing which I always say, and which is very
हम्म.
important for everybody, for every age group, is be comfortable in your skin. You
राइट.
don't aim for a skin which is like which you have seen. Korean skin, Korean genes. When we are Indians, we have brown skinned people, we have our own genetics. How can we get a Korean skin? Matlab, is it
यस.
possible? And even the
यस.
Korean skincare, if you go and see in Korea, Korea has two kinds of skins. One, there are people who have very oily skin, who are full of acne, but half of them are very clear skin. So you only see the clear skin, you don't see the struggles which the other half of the population goes through. So acne, the thing is, another thing which the parents and are always, the child is sitting next on the consultation chair and the parents are sitting, bahar ka bahut khate hain, junk bahut khate hain. This is a repeated complaint and repeated concern which is there. Now again, if I say mat khao, कुछ मत खाओ, रोटी सब्जी खाओ, क्या मैं खा सकती हूँ? मैं भी नहीं खा सकती, मैं भी बोर हो जाऊंगी वो घिया तोरी खा के. So it has to be a practical solution. दूसरी चीज, जो आप खाते हो वो आपके स्टमक से यहाँ नहीं सिक्रीट हो रहा है. Let me be very clear. Only one thing which is acnogenic. Acnogenic means which stimulates the acne glands is whey protein. I'm not even saying milk because milk has whey protein. अब लोग कहते हैं मिल्क तो नहीं पीते, पर फिर आप प्रोटीन शेक पी रहे हो, आप प्रोटीन सप्लीमेंट ले रहे हो. So whey protein in particular is something which stimulates the acne glands. So I see acne in adults when they start taking the protein shakes. So only one thing which I tell teenagers to avoid is milk products, because when you take it in a like if you're taking paneer or if you're taking dahi, the whey protein has been complex, so it will not stimulate the gland. If you want to take milk, there is something called as pea protein. Milk has two proteins, pea protein. So if you want to take a protein shake, so that is, you have to understand, chocolates are not to stimulate somebody's acne specific. I'm not going to give a blanket statement कि आप ये बंद कर दीजिए. देखिए, इंडिविजुअल सेंसिटाइजेशन होता है. इंडिविजुअली देयर आर पीपल जो मीठा खाते हैं, तो एक्ने हो जाते हैं. इंडिविजुअली चॉकलेट खाते हैं, वो एक्ने हो जाते हैं. चॉकलेट खाते हैं, वो एक्ने हो जाता है. इन सब में ये सब जो होते हैं, ये ब्लड सर्कुलेशन को बढ़ाते हैं. तो जब भी ब्लड सर्कुलेशन को बढ़ाते हैं, तो जाहिर बात है कि सिक्रीशन बढ़ जाती हैं. तो आपने थोड़ा कोक इज समथिंग अगेन, जो भी चीज सर्कुलेशन बढ़ा रही है, वासोडायलेशन कर रही है, जिसमें कोक है, अभी वाइन, चीज, ठीक है. और फिर भी इंडिविजुअली अगर आपको लगता है कि मैं इस दिन मैंने मीठा खाया, 2 दिन बाद, ऐसा नहीं है रात को खाया सुबह acne हो जाएगा, 2 दिन बाद you have acne. Then take care and avoid things. Something all acne people have to avoid. And milk में भी बड़ा specific है whey protein. तो अगर आप प्रोटीन शेक ले रहे हैं या प्रोटीन सप्लीमेंट ले रहे हैं, उसके इंग्रेडिएंट चेक कर लीजिए. बाकी जो हम बाहर का खा रहे हैं या जंक हैं, उसको नहीं करने का तरीका ये है कि जंक के साथ क्या होता है कि कैलोरीज आर वेरी इजीली अवेलेबल, न्यूट्रिशियस वैल्यू नहीं है. तो न्यूट्रिशियस वैल्यू अपने मील में ऐड करने के लिए सबसे जरूरी है और इंक्लूडेड रिस्क है. आप एक नॉर्मली वो हेल्पिंग होती है शाम को 4-5 बजे वाला जो स्नैक होता है, डू इट इन अ रॉ फॉर्म, इन द सेंस के फ्रूट्स कीजिए, सैलड्स कीजिए, जहां पका हुआ नहीं है खाना. जब आप बिना पका हुआ फ्रूट खाते हैं, फ्रूट उसमें मैग्नीशियम, सेलेनियम, कॉपर, ये सब चीजें हमारी बॉडी को बहुत ज्यादा जरूरत है, लेकिन पके हुए खाने में वो खत्म हो जाती है. तो ये आपको करना है. अब आपका बच्चा जो खा रहा है ठीक है, आदि हर चीज की बुरी है, लेकिन आप रोज शाम आप लोग तो बच्चा के खाएगा. और जो हॉस्टल में रहते हैं, फ्रूट्स काटना छीलना पॉसिबल नहीं है, तो केले खा लीजिए. द होल आइडिया है कि शुड बी अ मील जो आप न्यूट्रिएंट्स आपके अंदर पहुंचा रहा.
राइट. नाउ डॉक्टर, मैं फिर से वही स्किन केयर की ओर बढ़ना चाहूंगी. अगेन कमिंग बैक टू द सेम पॉइंट. ऐसे
कैन यू
बहुत
हियर मी
सारे
रूपांशु?
पेरेंट्स हैं.
हाँ, हाँ.
यस. तो ऐसे बहुत सारे पेरेंट्स हैं जो सनस्क्रीन लगाने से मना करते हैं बिकॉज दे थिंक कि जरूरी नहीं है बच्चों को सनस्क्रीन लगाने का. बच्चे क्यों सनस्क्रीन लगाएं, बस जॉनसन बेबी क्रीम लगा लो. मतलब अगर बच्चों के लिए बोला जाए, देयर इज जस्ट वन ब्रांड विच इज जॉनसन बेबी. आज भी बहुत सारे टीनेजर्स, द पेरेंट्स फोर्स देम
इसका मैं
टू
आपको
नॉट यूज
समझाती हूँ,
एनी सॉर्ट
इसका
ऑफ
मैं आपको
सनस्क्रीन.
लॉजिक
कैन यू
समझाती हूँ.
प्लीज? यस प्लीज.
ऐसा था हाँ, एज dermatologist also I am not in favor of बच्चे सोचिए जो बच्चा स्कूल जा रहा है, अगर आप सुबह सनस्क्रीन लगा के भेज दें, वो 6-7 बजे जा रहा है। सनस्क्रीन एक एक्टिव प्रोडक्ट है। एक्टिव का मतलब है कि वो स्किन की लेयर में रहता है, तो स्किन में जो ब्लड सर्कुलेशन है वो रेगुलरली आती रहती है। तो विद इन 2 आवर्स आपने कोई भी सनस्क्रीन लगाई हो, वो वहां पर नहीं रहती है जहां पर आपने उसे लगाई थी। तो अगर आप सुबह बच्चे को सनस्क्रीन लगा के भेज रहे हैं, तो जब उसको धूप की जरूरत, धूप में वो जाएगा, वो 2 बजे होगा जब वो बस में जाना है, जब सुबह वापस आना है या थर्ड फोर्थ पीरियड पीटी है, उस टाइम तक वो सनस्क्रीन इफेक्टिव नहीं होगी। तो उसका तरीका ये है कि पहली चीज तो स्कूल्स के लिए भी हम हमेशा ये रिक्वेस्ट करते हैं कि 11 से 4 बजे की धूप बहुत ज्यादा खतरनाक है, यूवी भी डायरेक्ट होता है। तो वो टाइम है जब आपको सन एक्सपोजर नहीं करना है। तो बच्चों के स्कूलों में भी ये चाहिए, और ये बात सबको समझ आ रही है कि जो अगर आपका बच्चा फोटो सेंसिटिव है या आप फोटो सनस्क्रीन लगाना चाहते हैं, तो यहाँ पर फिजिकल सनस्क्रीन की अहमियत बहुत ज्यादा आ जाती है। फिजिकल सनस्क्रीन सबसे अच्छा कौन सा अच्छा है? कैलमिन लोशन। अगर आप हल्का सा कैलमिन लोशन विद मॉइस्चराइजर स्किन के ओपन एरियाज पे लगाएंगे, फेस पे लगाएंगे, अगर बिल्कुल ही पसीना नहीं और वो बह नहीं गया, वो काफी हद तक आपकी वो कंट्रोल रखेगा, आपकी सन प्रोटेक्शन को कंट्रोल करेगा। मेरी रिक्वेस्ट ये है, पॉसिबल है और खासकर बड़े बच्चों के लिए अगर पॉसिबल है, तो जब स्कूल की छुट्टी होती है उस वो थोड़ा टाइम लगा के और फिर अप्लाई करेंगे। दूसरी होती है जो पेरेंट्स जो हैं, जो मदर्स हैं, बच्चों को बस स्टॉप से लेने जाती हैं, तो उस टाइम भरी दोपहर हो रही होती है, खुद वो सन एक्सपोज होती हैं और बच्चा सन एक्सपोज होता है। तो यहाँ सन से ज्यादा सन प्रोटेक्शन की बात करना जरूरी है। बच्चे छत लेके आइए, एक स्कार्फ लेके जाइए, उस पर डायरेक्ट सन ना आने दीजिए। तो आपको जब भी बात करनी है, आपको जब भी गूगल करके पढ़ना है ना, तो सन प्रोटेक्शन पढ़िए, सनस्क्रीन मत पढ़िए। सन प्रोटेक्शन एक पूरा लाइफ स्टाइल है, जिसका मतलब ये है कि आप धूप में गलत वक्त पे नहीं जाएंगे, आप कपड़े पहनेंगे, कॉटन के पहनेंगे जो मैक्सिमम एरियाज आपके स्किन पर करके कोशिश करेंगे कि आपकी धूप में खड़े होना है तो छतरी या स्कार्फ लेंगे। ये सब चीजें काम करती हैं यहाँ पर, क्योंकि बच्चों की बात आई, 2 साल से छोटे जो बच्चे होते हैं चाहिए। और सन जो है वो क्यूमुलेटिव होता है, मानी पूरी जिंदगी में जो आपने किया ना, वो लेखा जोखा आपकी स्किन रखती है। 2 साल से छोटे बच्चों को तो आपको 11 से 8 निकालना ही नहीं है, वो ऑप्शन ही नहीं है आपके पास। तो ऐसा नहीं है कि सनस्क्रीन लगा के आप धूप में चले जाएंगे तो वो सन जो है वो नुकसान जो कर रहा है वो कर देगा। और बल्कि दिक्कत ये है कि सबसे नुकसान क्या है? नहीं, सन टैनिंग में नुकसान नहीं है, लोगों को तो चेहरा काले होने की होती। हमारे में जो है, जो टेक्निकली और साइंटिफिकली, वी डोंट वांट द सन टू एज एंड डैमेज योर स्किन। तो हमारे लिए वो बहुत बड़ा असर है। अगर आप जो पावर रहते हैं जहाँ सनरेज बहुत डायरेक्ट होती हैं, आप देखेंगे कि उनकी स्किन का टेक्सचर थोड़ा सा थिक होता है। तो वो इसीलिए होता है, बस उनकी स्किन ने अडेप्ट कर लिया है वहां पर रहने के लिए। सो इट डू नॉट गो इन। कहीं ना कहीं ये वेस्टर्न मीडिया से और वेस्टर्न कंसेप्ट जो हिंदुस्तान में आते हैं, हम हिंदुस्तानी हैं, ब्राउन स्किन लोग हैं, हमारे यहाँ नहीं कर सकते।
राइट, राइट, बिल्कुल डॉक्टर। आई थिंक ये सबको समझने की बहुत बहुत ज्यादा जरूरत जरूरत है बिफोर वी डाइव इनटू द सोल्यूशन, बिफोर वी गो फॉर ओवर द काउंटर मेडिकेशन, बिफोर वी जस्ट विजिट द फार्मासिस्ट और बोले कि इसके लिए कुछ दे दीजिए बस। दैट्स नॉट द वे हाउ यू डू इट। वेल डॉक्टर, कैन यू प्लीज इलैबोरेट also about the grades of acne?
I cannot hear you very clearly.
Okay. Okay, doctor, the question was if you could please elaborate about the grades of acne. The grades of acne.
The range, are you asking?
The grades of acne, doctor.
Is it the grade of acne you're asking?
Yes, the grade of acne. Yes, yes,
Yeah. The acne technically is graded. Is it? It's the grades of acne we are talking about. Yeah, the grades of acne is graded from
yes.
grade 1 to 6, and the most important, the most scarring ones are the nodulocystic acne, where the skin forms nodules, the thick peel type nodules within the skin, and this happens on the back skin more because the back skin is thicker as compared to the face skin. Grade 1 and 2 is something which you can control very well with the face wash, anti-acne cream, and taking the other thing which is important is taking 8 to 10 glasses of water, because when you drink enough water, when you drink adequate water, the secretions which are being secreted by the body are diluted. So once the secretions are diluted, then the chances of getting affected is much less. So the only way for all of us, and for parents, these are important tips, that have 2 bottles in every member's name at your home during them are water, and they have to drink it throughout the day, whether they drink it 2 glasses at a time or 2 sips at a time. When you're drinking enough water, enough means only 2 bottles. I don't want you to drink 8 to 10 bottles of water, because then will get stimulated, and that's another problem, because whatever you say, then people go into an extreme. There was somebody who came and said, "Oh, I drink 7 to 8 liters of water." You don't need 7 to 8 liters of water. So 8 to 10 glasses of water per day. Once you go to acne 3 and 4, grade 3 and 4, there are sometimes a repeated course of antibiotics. Grade 6 is something where a regular treatment is needed, which might require oral medicines for a longer period of time.
Right. Now, doctor, we also see a lot of people who has the habit of popping an acne or any kind of lesion when they have on the skin. I know a lot of people. So how can that be harmful for us? Or is it okay if somebody is doing that?
No, it's not okay at all. If something is happening in your skin and it follows natural rules, then there are chances that it will heal without leaving a mark. But if you are getting into its evolution, you're trying to pop it, you're trying to take out the white head and black head, it definitely is going to leave a mark in us over there. And when the person comes to me and I say, "Okay, I can make out that you have been popping them." And if you're popping them, then nobody can help you. So most important, no, you don't have to intervene. And sometimes it happens that even the younger girls go into the parlors and they're trying to take out the blackheads and the whiteheads by SM, and the secretions are coming out and everybody is very happy. Oh, we took out all the dirt. You didn't take out any dirt, you just took out the oil which was being secreted. It will get secreted again. So the whole idea of especially in the nose area, if you have acne in the nose area, you can use a peel off pack. There are acne patches available, there are peel off packs available. The advantage of peel off pack is that you
Right.
apply it, peel it, remove some dead layers, and if there is any blackhead and white comedones without applying pressure. If you use too much of scrub, when you are scrubbing, you don't know how much pressure you are applying. So the whole idea of peel off mask is that you apply it, peel it, remove some of the skin, then it is needed at your age. So use a peel off mask. You can use it once a week. Then comes the home remedies. The home remedies like a multani tea clay. They go. If you have oily skin and you use the clay mask maybe once a week, twice a week, it will help in all controls. But it is not good to take care of your acne scarring. So use a peel off mask. You can use it once a week. But it is not going to take care of your acne scarring. So you decide what kind of skin. That's why I say, like, even once, if you visit a dermatologist who can sit with you and assess for you that this is what you need, then you can follow it up. Maybe to go to more high intensity treatments once a week, but at least you'll have a proper guidance of what to use, rather than being a bull in the china shop and using this and using this and using this and spoiling it.
Right. Right. So, so The entire thing sums up at one point where we are talking about visiting your nearest expert. It always comes to this. Uh, People who are trying whatnot on their skin and making it worse, guys, any condition or any disease is easily treatable in the initial stage. Now that we are talking about marks, the doctor just mentioned about a few of our actors, our Bollywood actors. If it was so easy to get remove of, to get rid of marks, then these people would not have been moving around with such marks. So now coming back to the same point
Exactly.
again, whenever you see initially any changes on your skin, visit your nearest expert. Now this is also a tricky thing, choosing your expert. Make sure you are doing some research in that case, like without experimenting on your skin, without doing research on your skin. Make sure you're doing some research on your expert whom you are visiting. Parlor wali didi doctor just mentioned, there are also a lot of parlors that offers dermatological services nowadays. I see so
Yes,
many parlors,
exactly.
na? Korean treatment and whatnot they offer nowadays, glass skin, and they have all the sort of treatments, and they also make videos showing differences before and after. So it's just a marketing gimmick, everybody. Please choose your expert wisely. Make sure you are visiting a certified dermatologist and get yourself treated in the initial stage. Moving ahead towards the next question, doctor. Uh, if you could please tell us, how do we manage acne for sensitive skin? Because those people are extremely worried all the time. How do we manage acne for sensitive skin, people with sensitive skin?
The sensitive skin is something that 90% of the people are not born with. The skin
Hmm.
becomes sensitive over the years because you have abused it. So first of all, that as we say now the type of skin, people come and ask me what is the type of skin I have. I said whatever you had, you have done so many experiments on it that right now it is sensitive skin. And what is sensitive skin? Sensitive skin means that if you apply anything, it will burn. If you go out in the sun, if the sweat comes, it will burn. If you are in the kitchen in front of the gas, there is any kind of heat, it will burn. Burn means you actually feel irritated. So, first of all, what you have to do, if you unfortunately have gone into that sensitive skin phase, scale down the products which you are using. Use the soothing products. And now every company has products where it is written for sensitive skin. You don't have to use abrasive products like the alpha hydroxy acids, the beta hydroxy acids, anything which is removing the layers of the skin. You don't need to use it because your skin actually has less layers of skin. That's why it's become sensitive. So the first job is to withdraw. Just stop everything. Just use a cleanser, use a basic moisturizer, and a soothing. There are actually soothing creams and soothing lotions available which make your skin normal. But sensitive skin is not going to go away overnight. It, as I repeatedly say, anything which has been given to you, anything whichever whichever remedy you are trying, please give it at least 3 weeks, 20 days for it to be effective. It's not going to be today you go there and tomorrow it's visible. Today you go there and tomorrow it's visible. And during this change, if there is an occasional acne or leave it, because any anti-acne cream is abrasive. जो भी acne को हटा रहा है वो कहीं ना कहीं थोड़ा सा स्ट्रॉन्ग है और वो जो स्ट्रॉन्ग है वो अगर आप सेंसिटिव स्किन पे लगाओगे तो वो और ज्यादा इरिटेट करेगा. तो अगर एक्ने हो, बिकॉज एक्ने के ट्रीट कर करके आप स्किन को सेंसिटिव कर दिया ना. पूरी स्किन लाल हो रही है, लाल दाने हो रहे हैं, एक को ठीक करने के लिए दूसरा, दूसरे को ठीक करने के लिए तीसरा, तो थोड़ा सा हाथ रोक लीजिए. जब स्किन की सेंसिटिविटी ठीक हो जाए, अपार्ट फ्रॉम स्किन की सेंसिटिविटी, start from work it. From that, if you are under regular care, if you are doing as the doctor is telling you, there is nobody in this world who has not been treated. It might be in 2 days or 2 months, but everybody gets treated. But you have to be honest to yourself. And the problem is that if I give you 3 things and I tell you कि ये मत कीजिएगा, आप घर बैठ के वो आलू का पेस्ट लगा रहे हैं और खीरा लगा रहे हैं, either whatever giving you, वो नहीं चलेगा, किसी को जिम्मेदारी लेनी पड़ेगी. So if you have gone to a specialist and the specialist is giving you something, be honest, just do that and let the dermatologist do the job. आगे तब तो इतनी प्रॉब्लम्स नहीं होती थी, आज की जरूरत क्यों है, क्योंकि सेल्फ बहुत ज्यादा हो रहा है. तो जब अच्छा, दूसरी बात ये है कि 70% लोगों का काम चल भी जाता है, ऐसे नहीं कह रहा मैं फिर में ना रहो, बट इफ अनफॉर्चुनेटली यू आर द पर्सन जिसको सूट नहीं किया और दिक्कत हो रही है, तो उसको समझिए और कहीं ना कहीं अपने फर्दर नुकसान से.
Right. Well, doctor, you have made my work so much easier today. I mean, आपने आज वो सारे सवालों के जवाब खुद ब खुद ही दे दिए जो मैं पूछने वाली थी शायद आपको. So we have almost targeted most of my questions. Uh, and now I'll quickly take you through our viewers' questions. हमारे viewers की तरफ से भी कुछ सवाल है जो हमारे viewers आज आपसे पूछना चाहते हैं. The first question comes from Jayant Deshmukh. पूछते हैं, is family history important in the case of acne assessment?
Family history is very important. I cannot hear you very well. So if I'm answering something, a different question, I'll repeat the question and then I'll answer. We are talking about
Sure,
family
doctor.
history.
Yes.
Family history is important. Definitely it is important because how your parents had the skin when they were teenagers, you will have similar kind of skin, but because we are living in different times, there are lots of preservatives in the food we eat, there is more pollution, so you might face a higher amount of acne appearance as your parents had. And if your parents have acne scars, then you should be very vigilant, because in maybe in my time when we were teenagers at that time, not many treatments were available for acne scars. So there are lots of 40-year-old, 50-year-olds who are moving around with acne scar treatment. So if and as I repeatedly say, to treat acne and to prevent it from being is more easier and more important than trying to treat the acne scar. So definitely there is a propensity of family history, and if you see that your parents had the problem, be more vigilant, don't try too many things on your own, definitely seek help.
Right. The next question, doctor, comes from Avishek Sen. Asks, can I use two products together?
Two products together means of who told you? If you are using it on your own, then you don't know whether they synergize or they antagonize each other. We definitely use two products together where we ask person to apply ingredient only on the affected area and a moisturizer something on the whole of the area. But you can't be using a niacinamide here, a vitamin C here. That doesn't work way. तो उनकी सिनर्जी है कि एंटेगनाइज है ये, और ये कौन आपको दे रहा है उस पर बहुत ज्यादा डिपेंड करता है.
Hmm.
जैसे कोई भी अगर आप serum यूज करते हैं तो serum goes to the deeper discussion over there. Then we ask the people, because the skin feels tight, then you can use a moisturizer on top. But I don't think this comes in the definition of two products. So try and avoid having two products on one area at a time.
Right. The next question comes from Aditi Srivastava. Asks, can the sun help clear acne?
You'll have to repeat it, Rupanjali.
Okay.
I didn't hear the
She asks,
question.
can the sun, can it clear? The question is, doctor, can the sun help clear acne?
Who are you asking about the sun exposure increasing the acne?
And can the sun exposure clear acne
The
somehow?
team has to make the audio clearer. This is there's no fun in doing it if you can't hear.
Right. Can you hear me now, doctor? Am I audible to you?
Are you talking about the sun exposure?
Yes, yes, yes,
When you
yes,
are out,
yes,
let me
doctor.
answer this question. What are the exaggerating factors of acne? When does the acne exaggerates a lot? Or is it the sun exposure? Is it uh, the issue is when you're out in the sun, the sweating increases. When the sweating increases, the sweat and the sebum, which is produced by the sebum gland. Skin has pores. What people complained of open pores and all, because these are the openings from where the sebaceous fluid is coming, from where the sweat is coming, and where the hair is there. You have room. Villus hair सोर्स तो वही है, उसी में से सिक्रीशन बढ़ती और घटती हैं. जब आप सन में होते हैं तो डेफिनेटली, और स्पेशली जब आप पोल्यूटेड एनवायरनमेंट में होते हैं, तो the sweat and sebum forms layer on your skin, and that leads to more chances of infection. So definitely, if you are in the sun, the chances of acne will increase. So what you have to do, if you have to go out in the sun, it's okay. Once you cut, what you have to do, you have to wash your face with a salicylic acid face wash. Buy salicylic acid, and salicylic acid is a foamy face wash, because the salicylic acid will remove that dirt from your skin. Once you have removed it, if you have removed it, if it's very hot, like these days it's around 45-50 degrees in Delhi, take an ice cube from the fridge, just dab dry with a towel. So you have to work on that so that the area is clean. And once the area is clean, बंद हो ये चल रहा है इसमें कीजिए. हाँ नहीं, ये नहीं दूसरा, ये हाँ निकाल के लगाइए, ये चल ही नहीं रहा. When the area is clean, आ गया, लाइट खोले. ठीक. I'm sorry, my battery was dying. So हाँ अब ठीक, वो चल ही नहीं रहा जब से. So when the area is clean, if you are indoors, if you are not going outside, you can spray. Telling you the basic things which we people living in tropical countries have to do. Once we come back from outside, we have to clean our face with a face wash. We have to apply ice so that whatever the injury has been done by the pollution and the heat is taken care of. Then you can take plain rose water, keep it in a spray bottle, keep it in the fridge, and just spray it on your skin. What you are doing is you are repairing whatever damage was done by the sun and by the pollution.
Right, right. Well, मुझे ऐसा लग रहा है कि शायद ये सेशन का लेंथ थोड़ा-सा और लंबा होता तो हम अ, थोड़ी और बातें कर पाते डॉक्टर आपके साथ. It was such an interesting session
ये
with you.
ये
We got to
अनएंडिंग
learn.
टॉपिक्स हैं और अनएंडिंग सवाल हैं.
जी,
दिक्कत पता है क्या है,
जी.
लोग सुन तो लेते हैं पर उसको अपनी जिंदगी में शुमार नहीं करते. तो अगर आप छोटी
हुँ.
छोटी बातें, ड्रिंक 8 to 10 glasses of water when you are going out, apply a basic clean moisturizer, apply a calamine lotion, don't rely too much of sunscreen लगा के आप सोचते हैं बस अब तो सब कुछ हो गया, वो नहीं होता है. So learn to carry an umbrella, learn to have a scarf. Your skin will give you blessings when you are, like, in your late 30s and 40s. So don't abuse your
Right.
skin.
Right. Well, that was the expert advice for today, and it was such a wonderful session with you, Doctor. I wish we got a little more time today, but I think we got to learn a lot from you. Thank you so much once again, Doctor, for your time. It has been a very, very informative session for our viewers today, and it was great to hear from you. We look
Thank you.
forward to meeting you very soon once again. And thank you, viewers, for your excellent participation. For more information and updates, stay connected on our page, Radiance with You, and make sure you follow us and subscribe us. With that, we would always want you all to stay safe and stay healthy and take care of your skin, like always. Thank you. You all have a good day.